Welcome to the Paul Spradley Show, a show dedicated to real strategies from real people practicing real leadership in diverse and inclusive cultures. And now here's your host, CEO of the diversity training firm, the Care-Based Leadership Collaborative, Dr. Paul David Spradley.
Good morning, world. That's right, this show has officially been listened to in multiple countries around the world. I'm excited. That means I have to learn greetings in a few other languages, I guess, including French. I think Pam, my guest, was speaking French today. I'm excited to dive right into the interview. My guest is Pam Golden. Pam is the executive director for the past 7 years of the Pittsburgh Child Guidance Foundation, an organization dedicated to improving the emotional health and well-being of children and youth living in Allegheny County by providing grants and collaborating with public and private organizations to implement innovative policies, practices, and programs. Pam is also very active in the community and serves on many boards. Pam, welcome to the show.
Thank you. I'm glad to be here.
I'm glad that you're here. So I want to dive right in. What is the Pittsburgh Child Guidance Foundation, and what do you all do?
We are a nonprofit foundation that was established 32 years ago. Originally, it was the Pittsburgh Child Guidance Center and provided direct service to children. So it was counseling mostly for kids who are having mental health, emotional health issues. And so this foundation is kind of a continuation of that work. So instead of doing direct service work, now what we do is we do grant making, we partner with a number of organizations, and we try to take on issues that might otherwise go ignored to address the issue from the child's perspective.
Yes, one of the things that I'm really interested about is where your funding goes. Like, how do you fund organizations in the region? What do you support?
So we are currently involved, we're addressing the issue of families with children experiencing homelessness. So we have a number of funding partners. We fund some research projects. This gives us a better understanding of the issue and helps guide our decision making regarding where the money might go. We do provide grants to direct service organizations, shelters, and people who are serving families with children. And then we also do training to educate the people who are working and providing that shelter care work. The turnover rate is about 38%.
Wow.
And so trying to make sure that the employees feel valued, and also that they're working with the best practices. So we do the training component as well. So we did that, but previously we've been addressing this issue for the past 5 years, but previously we're addressing the issue of children whose parents are incarcerated. So again, these are issues that are from the child's perspective. The issue is around we don't want to see the child victimized twice, and most of the time they're issues that were bad decisions by parents, other people in their lives, and they end up living with the consequences. And so our goal is to try to mitigate those circumstances and give them a brighter future.
Yeah, so people don't often think about homelessness and children, right? Like, they see people on the side of the road. Talk about what that looks like actually in the Pittsburgh region, and what does homelessness as it relates to children look like?
Well, in terms of just the magnitude, the Department of Human Services does what they call point-in-time count, and they in January go in the shelters and emergency care and transition, and they're also on the streets, and they do an actual count. So they're estimating that this past January there were roughly 800 people.
Okay.
However, in terms of the Department of Education does a count, and their estimate is closer to 4,000
Wow.
children. And there are a number of reasons for the disparities. So for one thing, we have better accounting methods, better methods for accounting children experiencing homelessness. So the count is probably more accurate. And then the second thing is that there's been an increased level in families experiencing poverty, and so the numbers have increased. So.
Does that mean, just for the folk who might be thinking that this is a person that's living on the street? Does homelessness for a child mean living on the street?
No, that's one example. You're more likely to see youth, not children. But in some cases, they're doubled up, so they're also called couch surfing. Sometimes families are sleeping in cars. And one of the things, particularly with families with children, is that the parents don't want to lose the children, so they will go to great lengths to hide the fact that they are having housing insecurity issues. And then some are in shelters. We've worked with Women's Center and Shelter for a number of years. And I remember the first time I spoke with the CEO, Nicole, actually it was several years ago, prior to her being appointed as CEO, and they were at 103% capacity. So, wow. I mean, wow. These are issues. And then I remember another time I visited a shelter, and a little kid came in, and the story I was told was that he came in with his sister, and he was saying, and here's the playroom, and here's the bathroom, and so clearly the family had been there before, and they were kind of cycling through the system. Wow. And so those things aren't good, and they have a long-term and lasting impact. I mean, how do you get up and get ready to go to school if you're hungry or you've slept in a car overnight or...
Yeah, so talk about the impact on the development of the child, right? So you're saying it has this lasting impact, but they're also kids. We don't think about them being like homelessness and home insecurity as being a thing that children have to navigate, but what does that do to their development?
Well, it can have an impact. It can show in a number of ways. For one thing, children who are homeless or have affected by adverse childhood experiences, and there are a number of things that have been identified as what are called ACEs, adverse childhood experiences, and they can include substance abuse in a household, domestic violence, sexual abuse, the incarceration of a parent, and then a few years ago, the homelessness was added. So kids who grow up with multiple ACE negative adverse childhood experiences can have developmental delays. They're 4 times more likely to have developmental delays. They have higher rates of absenteeism. They are at greater risk of not graduating from school, so then that ultimately leads to underemployment or unemployment. And so it can have a ripple effect for many years if it's not addressed.
Wow. Yeah. Thinking now about the cycle of this happening, I'm growing up and not knowing where my resources are. What are the barriers that exist for a family that is experiencing homelessness, or for a child? Like, what are some of those things? So,
I am not a clinician, but the clinicians will look at a number of issues that will affect a family, and so it can be anything from mental health issues. There could be substance abuse, any number of things that can, poverty, the unemployment that can lead to poverty, that can send a family into turmoil. And there was a recent study actually that was on NPR. They were talking about people having less than $400 in emergency money. So if you can imagine, you have a medical emergency, an auto problem, and it wipes out your resources, and then it can put the families behind in terms of paying their rent or paying their utility bills, and it can put them at risk, and particularly if they let the issue escalate and don't seek help early on when it's a small problem. Otherwise, it just grows into a bigger and less manageable problem. So.
And $400 feels very realistic, right? Like sometimes people think that it's a lot more, but I have had experiences in my life where I was like, I don't know where if I needed $400 right now, where I'm going to get that.
Right, and that's a large number of the population who really don't have that $400. So any one thing can just send people over the edge. Another issue is, frankly, around transportation. We work with South Hills Interfaith Movement and Allegheny Valley. And they provide services in suburban communities, Allegheny Valley's north and Shim in the south. And I just had a conversation with their executive director. They're seeing 1,900 people a month.
Wow.
Coming in their food pantry, and AVAC works with this a group of churches, and they help people through the churches. But so one of the challenges there is the transportation's an issue. There might be a bus in the morning and a bus in the evening. So if people were getting jobs, they become harder to get to, and that just contributes to this cycle of poverty and not being able to lift themselves out. Families not being able to lift themselves out.
You've had to meet some pretty incredible people and seen some interesting stories in your time as executive director of the Pittsburgh Child Guidance Foundation. What are some of the more memorable experiences that you've had of folks that did not have a happy ending, and then the ones that did have happy endings?
Well, and these are stories that I hear. Well, sometimes I do make site visits, and so I hear some of them directly, but some of them are passed on to me. And actually, one of the ones that just always stuck with me, there's an organization called Ward Home, which recently joined with Auberly. And they provided homes for kids who were in transition and could not live at home for whatever reason. So one young man got a full ride, a scholarship to a college in the South. But he couldn't get there. One of the parents packed up their car, drove him to Atlanta, and sent him off to school. And those heartwarming stories, that's just like an amazing gift that this person gave to this child, this young adult, to send him on his way. So he did, because otherwise he would not have gone to college. And then I've met a couple of other young people. One young lady who was in there was violence in the home. And, at this tender age, she realized that it was not the place to be, the thing to do. And she put herself on the right path, and she went to college. She stepped out for a while, but she's on her way back, and we stay in touch. And she's helping other kids. She wants to be a teacher, and so she works in the school, and it's just great. But she realized that she wasn't in a good situation, and at a tender age, kind of took it upon herself to go and get help from other adults in her life. And then the Allegheny County has a program for youth, and I'm blanking on the name of it, I've met a number of young people who they're peer counselors. They do peer-to-peer work, so that they're talking to people in situations that they've been able to extricate themselves from. And I just have a great deal of admiration from about the work that they do.
Sometimes when we're out doing trainings, people will say things like, they'll make the assumption that homelessness is a choice. I don't give money because they chose to be homeless. And oftentimes they're not thinking about even going backwards, seeing that there's kids, there's children, that this is not a choice, right? And so what would you say to someone who might think like that?
Well, I think one of the things is, and there are plenty of things that you can do other than give money. I want to come back and talk about an initiative we've been involved in called Big Berg. But I think I've done volunteer work in shelters. So you can do that. You meet the people. And in volunteer work in shelters, you could fix and serve meals or go and read to kids. And I think part of what we have to do is, in addressing the issue, is to humanize it so that we're seeing them as people. And so it's making eye contact. You might choose not to make a donation, to give them money, and that's okay. But just to be able to acknowledge them. Language is a very powerful weapon, or whether it can be used as a weapon either way. But, so we don't talk about homeless people. We talk about people experiencing homelessness. This is a temporary situation. This is something that they can work themselves out of. But it's not a label, and so they shouldn't be labeled as such. But I do think volunteering in shelters is a very rewarding way to humanize it and to see the issue. So there are a number of ways that people can get involved. And as I said earlier, the churches, there are a number of churches that are really doing a lot of work, and they'll have training programs to help people feel more comfortable in being involved with families in these situations, in these fragile situations, and you can be a part of helping lift them up. I think another thing, we do some advocacy work. One of the challenges is that we have a system that was built a long time ago, and frankly wasn't built to accommodate the volumes of people who are having these issues these days. So, and a number of policies and procedures really need to be changed, and so people can also get involved at that level. And we've done some work. We've provided some research grants that have identified opportunities for change or for process improvement, and we've been able to present those to the state, and they've accepted the changes, and so it's a slow process, but advocacy is another way to help out.
Yeah. What are some of the things that people, what are some of the policies and things that people might not be able to see that need to change?
Okay, I'm getting out of my league, but there are issues around, some of the issues are related to work requirements where they're right on the edge, so they make enough money, they start to lose benefits. So it costs them more to work, and so sometimes that's a challenge. I mean, I just talked to one of the shelter executive directors the other day who was saying that she wanted to give a staff member a raise, and her question was, do I have to take it? Wow. I mean, she was working, but she didn't want the raise because it was going to throw her over the edge, and that she was no longer to be eligible for other benefits.
Wow, what a conundrum, right? Like,
exactly.
So now you're stuck in this space of, do I take a raise, make more money? And because with the raise also comes status, right? Like you've demonstrated that. So
right.
Do I take this?
Right.
Or do I continue to get these benefits? And it's
that I desperately need.
It's frustrating that we live in a space where we have to choose. That there's so many people in the Pittsburgh area that have to make that choice.
Right.
Of, I don't want the raise because I need this
right.
other thing.
Right. So that's a challenge.
What are some ways that people can give back? I know you talked about the Pittsburgh app, or some ways that folks can connect specifically around homelessness as it relates to youth.
Okay, so several years ago we got involved in a project called Pittsburgh, and the idea was that it's actually a web-based app, so it's an app, but it also works on the computer, and it was to help fairly quickly identify resources for people living on the streets. And so, actually the way it came about, it's a partnership among law enforcement and people living on the streets and service providers. And Marita Bryant, who at that time was a senior, she was an assistant, I think a deputy director with the city police, said that they had their resource was they would keep a piece of paper folded in their cap, and if they encountered a person on the street, they would pull this piece of paper out and say, oh, you could go here or you could go there. Well, you didn't know if the shelter was full, or if the hours were still accurate. I mean, you have a piece of paper, it's out of date in a couple of days. So her question was, is there an app for that? And so a team got together, it was Informing Design and the Homeless Children's Education Fund, and said, yes, we could help with this problem, we could make an app. And then they came to me early on and asked for if we would support this. And we were the first funder in and got behind it. Saw the potential to use technology to help with this issue. So it's bigberg.com, and what I love about it is the design is very simple. Everything that's listed on the app is a free service, so that if there's a charge, it doesn't go on the app. And it can be used by individuals. You load it on, I've done this, and you encounter someone on the street and they need help, and you say, well, okay. And it has a geographic code in it, so it's going to give you resources near where your physical location is, and that is I think it's been a tremendous support. It's like I said,
what kinds of things are in the app?
Well, you choose. So if you say, well, I need food, I need shelter. If you want to say I need food, you click that and it'll show you pantries or in the area, or shelter, and it will connect you with shelters that provide housing, clothes. One of the issues for some people who are experiencing homelessness is where do they get their laundry done, where and how. So things like that. So and the app is designed so it's divided by age. There's a little bit of a profile there. So age group, so that because younger people are looking for different things than slightly older people,
right.
or if it's family with children. And so you can pre-select these things and then find resources that are going to help improve your circumstances.
Okay.
And it's fairly immediate. It's also used by 211. We work closely with them, and we have people. Part of our grant is used to help update it regularly, because the whole idea is that when you click onto it, the hours need to be accurate, the service needs to be accurate, so that the people are getting good information that's going to help them and not further frustrate them.
Right. Are there challenges doing this work, serving a community that oftentimes is invisible?
There are plenty of challenges. The invisibility is a big problem. One of the things, I spent some time at one of the shelters, and there was a woman with 2 children, and she was involved in a domestic violence situation, and it got to the point she just couldn't take it anymore and decided to leave and went to the shelter. But in the course of our conversation, she's talked about the shame of admitting her terrible situation, and she didn't want to tell her family, so she stayed longer than she should have. And then she did finally leave, and she ended up in the shelter, and I think was on the path to improving her life. But you have a situation like that, and particularly around the issue of shame and admitting you have made a big mistake, or you have a problem that you didn't see initially. Part of our conversation was around what are some of the indicators that we could use to prevent homelessness, to keep someone from ending up in a shelter. And if they're not willing, if they can't admit that there's a problem, it's really hard to intervene, and so you end up intervening when the problem has gotten bigger and
right.
maybe out of control. So I mean, that's one of our challenges, and is that what can we do to prevent people from ending up on the street? And so we talked earlier about some of the profiles, and homelessness disproportionately affects African American community. It's like 40%,
wow.
Which in the population in Allegheny County of African Americans is closer to 23%. So the LGBT community is disproportionately affected by homelessness. So we are seeking solutions. In Allegheny County, we were part of a collaboration of a number of foundations and service providers that is working to prevent homelessness. So there's a plan to make it a rare, brief, or non-reoccurring situation by 2022. And it's a challenge, because if you can't identify red flags, then it makes it harder to prevent it. You end up on the intervention side more than on the prevention side.
Yeah.
And so that's another challenge, not just for us, but for our service providers.
I think we've only been talking for about 30 minutes, and already you've talked about these different entry points of homelessness, right? Like, so race can be an entry point, gender, sexuality,
right.
You said that people can enter homelessness through domestic abuse.
Mm-hmm.
Children can be the recipients of all of these components, right? Like, and
victimized twice.
Wow.
Right. Exactly.
So what does success look like for the Pittsburgh Child Guidance Foundation? And what are some things that you all have done that you're proud of?
Well, I think the Big Bird app is a help to any number of people helping to mitigate those circumstances of people, especially people on the street. I think the education programs we talked about earlier for shelter care workers, so we've done training programs like one was around trauma-informed care, providing trauma-informed care. One that taught about early childhood development, so that people who are caring for these kids understand some of these issues and what the kids are going through and what they should be looking for. And then we've done things to help the caregivers, teach them protective strategies, because they're taking in all of this trauma and hearing about it. And so the education programs, that's something. So and then some of the research that we've done to try to understand the issue, so that we're making good decisions about our grant making and helping our partners do the same.
Yeah.
And then I think the other thing is we've done a lot around collaborations, not just participating as collaborators, but also bringing people to the table to collaborate.
So last question, I am listening to this show right now and I want to do something. I know people that are in vulnerable situations. What's advice that you would give to just the everyday person?
Well, especially if you're in Allegheny County, download bigburg.com.
Bigburg, B-I-G.
B-U-R-G-H.com, bigburg.com. And so when you encounter someone that you don't have to reach in your wallet, you can help them find some of the resources that they need. If people are able to volunteer in shelters, like I said, read to kids or go. I've made meals, served meals, there are any number of things. Educate yourself. Learn about the issue so that you're not just looking at somebody saying, well, they're just out there because they want to be. So education, there are a number of seminars, symposiums to understand the issue. Advocate for change. We just need to change the system. It's an old system that doesn't accommodate the volume of people that are experiencing these challenges.
Pam, thanks so much for being on the show. If people wanted to find more information about you, where could they go?
They should visit, it's very long, Pittsburgh Child Guidance Foundation.org.
Okay.
Okay.
That's simple enough. Thank you so much. I appreciate you.
Thank you. My pleasure.
Well, that's our time for today. I'm grateful for you to listening. Thank you. And if you like this show, please be sure to subscribe, comment, and then like it in that order. It helps us boost our presence on iTunes, Spotify, and everywhere else podcasts are hosted. My team and I would love to do a training for you. If you have trouble seeing homeless people as people, let us come in and work with you. You can reach out to me on social media at Dr. Paul Spradley or share my information with your organization. That's it for today. Have a fantastic week. And please remember to keep on caring.